If you are traveling to any area where malaria is common, please remember ABCD of malaria prevention. I am Dr. Nadeem Sajjad Raja. Please subscribe my YouTube channel, Dr. Raja Nadeem Sajjad Official, and press bell icon button. Number one is the awareness of risk. Number two, bite prevention. C for chemoprophylaxis. D, diagnose promptly and treat without any delay if there is a malaria infection. So what is awareness of risk? The current highest risk areas in the world are Africa, South and Central America, Asia, and the Middle East. There is a highest risk for tourists traveling outside the urban areas to countryside or visiting game parks than business travelers to downtown offices, overland backpackers, those undertaking prolonged travel, and expatriates intending to reside in the area. So highest risk categories are pregnant women, asplenic patient or patients without spleen, young children, people living with HIV or AIDS. Number two, B for bite prevention. Better to avoid mosquito bite because chemoprophylaxis is not 100% effective. Bites occur mainly between dusk and dawn, although some species of mosquito which can transmit dengue fever bite during the day also. Keep legs and arms covered all the time. Use mosquito repellent. Sleep in air-conditioned or screened rooms. C for chemoprophylaxis. Chloroquine is still used in areas where chloroquine resistance is still very low. Other options are mefloquine, chloroquine plus proguanil, Malarone, doxycycline. If there is any clinical suspicion of malaria infection, please diagnose and start treatment quickly to reduce the morbidity and mortality. Thank you very much for watching this video.